thing is, a building this age was never designed
for the way we need to help people today.
It's so frustrating these wards aren't geared up
to deliver the therapies we want to offer.
A person's privacy and dignity are key to supporting their recovery.
And we need a more modern building that will provide the space.
For us to treat our patients in a way that maintains their dignity.
I know exactly what my patients need.
But it can't be wholly provided here.
In a way that brings the right benefits.
But we're so short of beds.
People have to be treated in other hospitals and facilities.
Sometimes outside the region, so regular visiting by family and friends is difficult.
We've got a brilliant team, they're dedicated and highly skilled.
And they've got years of experience.
Against the odds, we achieve good health outcomes here.
But at a purpose-built site with everything in one place,
we could do so much more.
I was very young when I became unwell. I was only 16. My mum died when I was 6. I found that really hard. I had a very rocky road. I started to drink, I used drugs, and I became violent, and people couldn't manage me anymore. I got sent to a hospital far away, and I couldn't see my family. My family couldn't come because my dad's getting older, my grandma's getting older. They don't work. I couldn't see them. I was very scared. Since I've been here, I can see my family really regular. I've got leave now. I've really moved forward and I feel safe. That's important. I think I feel safe because I can see my dad. I even see my dog in the grounds once a week, and that's really, really nice. They can ring up today and they can come and see me tonight, and that's wonderful. It makes me feel good. It makes me feel loved. And it's very special because I know then I've got a focus to look forward to my next visit that helps me get up that next day and move on my care pathway and continue with my therapies to get well.
Well, I think it's really important to appreciate that people who use medium secure services, when they come to the service, they can often be acutely ill. They're at a very vulnerable stage of their lives. Now, if they were physically ill and needing an A&E department or an intensive care facility or something, you know, we would absolutely make sure that we've got the very best facilities possible. And a sort of medium secure service is a bit like a high dependency unit or a sort of intensive care type service. It needs to take people who are really very ill and put them back together again. This time we're talking about emotionally rather than necessarily physically. And the facilities we have at the minute do make it really difficult to do that. The great thing we have at Scott Clinic is our staff. We've got some of the best staff in the country there. But the facility itself, no private bedrooms, no bathrooms, no showers that are private, really make it difficult if you think about it as somebody in a really emotionally vulnerable place to think about engaging with therapy and services to get yourself back on your feet. Just think how much positive benefit there is if you've got your own space, got your own privacy, got your own dignity back in a sense. So for all of those reasons, it's really critical that we move our service.
Scott Clinic is no longer fit for purpose. It doesn't comply with all the Department of Health guidelines and national secure standards because of its age, and also rightly the standards are continually improved. So, while there's a top-class team of professionals trained and experienced in modern, effective therapies, their workplace is critically hindering their work. A move to a new, purpose-built 90-bed unit at Maghull makes sense for everyone. For patients, carers and staff. Being close to Ashworth Hospital means all the clinicians and therapists who work across secure services will be close by, in one place. Every last detail of the new site will be designed to maximise health outcomes. Unlike Scott Clinic at Rainhill, it will be viable, sustainable and able to accommodate future needs. The new hospital sited at Maghull will be a safe, secure environment where patients get the best care. They'll be closer to home, so families can visit easily, aiding the recovery process. All the things which we know drive recovery could be provided. Dignity, privacy, physical well-being, regular contact with loved ones, a positive, supportive environment. These will be better provided for in the new hospital. A state-of-the-art UK Centre of Excellence will also help keep funding in Merseyside, supporting employment and the local economy in the future. And having everything integrated at one efficient site will radically reduce costs. We'll no longer be paying extra for beds in other regions and moving patients around the country. We won't be keeping staff on the move when they should be delivering care. Ultimately, the proposed new facility at Maghull is all about doing the best for people. We want to provide our staff with everything they need to make their work count. We want to give patients more chance of a speedy recovery. We want to secure funding and jobs for local people. That's why we need to build the new medium secure unit at Maghull.